in the chat box. Parallelly, YouTube streaming is also going. The link has been posted in the chat box.
Hello. Yeah.
Good morning,
Good
madam.
morning. Good morning, everyone.
Good morning, madam.
Good morning. I'm audible, no?
Yes, madam, yes.
Okay.
Good morning, ma'am.
ഇന്നലെ ഫസ്റ്റ് സെമിസ്റ്ററിൽ വയ്യാതെ ഇട്ടിട്ട് ആ കുട്ടി പറഞ്ഞു വീട്ടിൽ പോകണമെന്ന് പറഞ്ഞ് മാറി പറഞ്ഞു. ആ കുട്ടി വിളിച്ചു പറഞ്ഞിട്ട് അവർ വീട്ടിൽ നിന്നൊക്കെ വന്നിരിക്കുന്നു. പക്ഷെ ആശുപത്രിയിൽ വിളിച്ച് പറഞ്ഞിട്ടില്ല, ഇൻഫോം ചെയ്തിട്ടില്ല. വിളിച്ചായിരുന്നു വാർഡെല്ലാം പോയി വന്ന് പറഞ്ഞു കുട്ടി വീട്ടിൽ പോകണമെന്ന് പറഞ്ഞു.
May I start, madam?
It's not yet 9. Is it 9? Okay.
Yes, ma'am.
Yeah, start.
Okay, madam. Okay. It's a highly eventful day for Ashwini College of Nursing, Thrissur, Kerala, being entrusted to conduct a national level webinar on forensic nursing. The tagline is Seeking the Unseen. A very fine morning and a warm welcome to all who have joined here for the webinar. I'm Sheena Sunny, final year BSc Nursing student, Ashwini College of Nursing, as the moderator for the webinar. These days, nursing is not limited to basic concept of patient care and reorientation. The changing times, war and skills and sophistication, technical and legal knowledge and holistic approach. As the crime graph is racing meteorically in parallel to rise in the diseases, here lies the significance of forensic nursing. As we all believe, effort is supported by prayers too. Let us seek God Almighty to shower His blessings upon us to conduct this webinar. I invite final year BSc Nursing students for the invocation.
There shall be showers of blessing. This is the promise of love. There shall be seasons refreshing, sent from the Savior above. Showers of blessing, showers of blessings we need. Mercy drops round us are falling, but for the showers we plead. There shall be showers of blessing, precious reviving again. Over the hills and the valleys, sound of abundance of rain. Showers of blessing, showers of blessings we need. Mercy drops round us are falling, but for the showers we plead. But for the showers we plead.
Now I invite Ms. Sona Tomi, final year BSc Nursing student, Ashwini College of Nursing, for the welcome speech. Sona, please.
Thank you, Sheena, for inviting me to present the welcome speech. Respected principal, vice principal, resource person, faculty members, all the invited delegates, and my classmates. A very good morning to one and all. On this auspicious occasion, I consider this as a great pleasure to welcome all the dignitaries who have joined the webinar. It's a matter of great privilege to welcome the backbone of our institution, Dr. Lieutenant Colonel Rosie K.O., Principal, Ashwini College of Nursing, Thrissur. I feel great and proud to see that the webinar has been organized under the guidance of our principal. I welcome you, ma'am. Next, I would like to welcome our Vice Principal, Professor Kavita B., Webinar Organizing Secretary, Ashwini College of Nursing, Thrissur, who guided us throughout the webinar. Welcome you, ma'am. Next, I would like to welcome Dr. Uday Kumar, Professor of Forensic Medicine and Medical Superintendent of Father Muller Medical College Hospital, Mangalore, for this webinar, who will share with us the overview, concept, and importance of forensic science. Welcome you, sir. Then I welcome Mrs. Shiba Joseph, Senior Nursing Officer, Jayaprakash Narayan, Apex Trauma Center under All Indian Institute of Medical Science, New Delhi, for this webinar, who will share with us the roles and responsibilities on comprehensive care of victim and family. Welcome you, ma'am. Next, I would like to welcome Mr. Varghese P.A., retired EYSP and Assistant Professor in Bharat Mata School of Legal Studies, Ernakulam, who will be orienting us on Indian judicial system and fundamental rights. Welcome you, sir. Then I welcome Professor Rashmi Sia, HOD of Community Health Nursing, Ashwini College of Nursing, who is here to felicitate the gathering. Welcome you, ma'am. I also take this opportunity to welcome faculty coordinators, Mrs. Delna P. Davis, Assistant Professor, and Mrs. Sadevi P., Lecturer, Ashwini College of Nursing. Welcome, madams. Now, I welcome all the faculty members of Ashwini College of Nursing to this webinar. It is my privilege to welcome all the delegates who registered and joined with us for this webinar from various parts of our nation. At the end of this order, I welcome all my classmates to the webinar platform. Welcome you all. I hope this topic will be interesting and beneficial for each one of us. Once again, I welcome all of you in this webinar. Have a nice day. Thank you.
Thank you, Sona. Parallelly, YouTube streaming is also going on. The link has been posted in the chat box. A gifted teacher is one who puts all efforts to bring out the best in the students and give wings to soar into the sky of knowledge. We, the students in Ashwini Nursing College, are highly fortunate to have our most respected and beloved principal, Dr. Lieutenant Colonel Rosikio, Madam, for the formal inauguration of the webinar. I welcome you, Madam, for the inaugural speech. Ma'am, please.
Thank you, Sheena. Welcome everyone to this webinar. Kavita, this college, eminent speakers, Dr. Uday Kumar and medical, Father Muller Medical College Hospital, Bangalore, Maba Joseph, JPNATC, AIMS, New Delhi, and Assistant Professor of Bharat Mata School of Legal Studies, Ernakulam, organizing committee members, faculty members, distinguished delegates, students, and all those who helped us in organizing this webinar. Once again, warm and pleasant good morning to one and all. My house is near Kerala University of Health Sciences, and I stay behind the Government Medical College, Thrissur. For the past 6 years, I have been crossing the Government Medical College Hospital to travel to Ashwini College of Nursing. On my way, I every day see the Department of Forensic Medicine or the Office of Police Surgeon in the Government Medical College Hospital. I casually read through that board and just come off and continue to travel to Ashwini College of Nursing. It never created any thought in me. But after implementation of the latest syllabus, the semester-wise syllabus, having come to know that some amount of forensic nursing topics need to be taught to our students, I became little sensitive about this topic. Nowadays, whenever I cross that forensic medicine department, I look at that board with a little bit of attention. I become a little more sensitive about this. Started developing a felt need to understand more about this particular topic. And then I started noticing about this topic, implementation of this topic in our day-to-day working atmosphere. And then also I noticed that doctors from Ashwini Hospital go to court either as a witness or to provide evidence in some trauma cases and cases required these kind of interventions. I feel that nurses, I've never seen any nursing officer going for this purpose to the court. Maybe because we nurses are not so much involved in this aspect of patient care management, I believe. Maybe in future, we may be involved much more than what is going on today. So since there was a felt need, we thought this faculty together, we were thinking about arranging a webinar, and the topic came as that the best topic we thought at present is forensic nursing. So we tried to pull in the experts in the subject, requested them, and we could pull in and we could arrange a webinar on this particular topic. I welcome all the delegates who have joined us to attend this today. And I'm sure that at the end of this webinar, all of us will be better knowledgeable about this particular topic, and we will be able to implement our knowledge in future in the course of our call of duty. I extend my best wishes to all the eminent speakers and also to the delegates. May God Almighty bless all of us to understand and participate, listen, and interact in the seminar better. Let us all have a meaningful, useful webinar experience. Without extending my talk further, I officially would like to inaugurate this program. Once again, extending my best wishes and welcoming all of you who have joined here. Thank you all for joining us today. Have a blessed day. Thank you.
Thank you, madam. All participants are requested to fill up the pre-test form. The link has been posted in the chat box. Next, we have come to an important part of this session, theme revealing. To reveal the theme, we have an eminent personality with us, Professor Kavita B. Madam, Vice Principal and HOD of Mental Health Nursing, Ashwini College of Nursing. I invite you, dear Madam, to reveal the theme and to speak few words thereon. Madam, please.
Thank you, Sheena. I am audible?
Yes, ma'am. Yes, you're audible.
Respected Principal and beloved Principal, Dr. Lieutenant Colonel Rosie K.O. Ma'am, Professor Reshmi Sia, today's distinguished speakers, dear colleagues, delegates from various parts of Kerala and India, and my dear students. A welcome and warm good morning to one and all. It gives me a great pleasure to greet every one of you to this national webinar on forensic nursing organized by final year BSc Nursing students of Ashwini College of Nursing. Nursing profession is basically a human performance focused on physical, psychological, and spiritual needs. In healthcare system, nurses often meet clients, families, and population victimized by accidental or deliberate injuries, exploitation, or ill treatment, but are not prepared to deal with them. Professional nurses who provide special care to the victims of violence and abuse like sexual assault, intimate partner violence, accidental injuries, and death are known as forensic nurses. Forensic nursing is a specialty in nursing discipline, which brings the concept as well as the principles of both law and nursing science together. This creative and evolving specialty seeks to meet the needs of the healthcare system with legal problems. Today, applying legal science in nursing has formed vital roles in clinical research. The advancement of forensic nursing in the last decade has developed a few new and better image of the nursing profession and provided nursing service to living and dead people. This discipline provides a new perspectives on the approach of holistic care for patients at hospital and community health centers involved in legal issues. Many organizations, including the World Health Organization and the International Association of Forensic Nurses, have stipulated the legal content and concepts should be taught to the undergraduate students as well as the nursing alumni. Therefore, with respect to the critical role in providing care, it is obligatory to include the educational programs of forensic nursing as a priority in continuing nursing education program and in the curriculum at different academic level. The Ashwini College of Nursing is always in the frontier to develop have always placed a renewed emphasis on the professional enhancement of nurse. Hence, I'm extremely delighted to announce the theme for this national level webinar, Forensic Nursing Seeking the Unseen. The comprehensive aim of the webinar is to understand the importance of forensic science in total patient care and to recognize the forensic nursing as a specialty, discipline, and in professional nursing practice. At the end of the webinar, the participant will be able to describe the nature of forensic science and discuss the issues concerning violence and sexual abuse. Identify the forensic team, role, and responsibilities of forensic nurses in the total care of victims of violence. Develop a basic understanding of the Indian judicial system and legal procedures. I would like to take this opportunity to express my sincere thanks to the organizers and in particular our honorable speakers. All of them have been working with us since the beginning of the planning stage. They are still here today for all of us, even though they are very busy with their responsibilities at their own agencies. We truly appreciate your dedication and, of course, our final BSc nursing students for their untiring effort in organizing this webinar. I hope that everyone would take this result of this program in caring of the victims of violence and abuse and advocate for them. I once again thank the organizer and principal, Madam, for giving me this wonderful opportunity. Thank you.
Thank you, Madam, for introducing the theme and highlighting the objectives of the webinar. Dear delegates, hope you all have filled the pretest form. If anybody doesn't have filled the pretest form, kindly, please fill it. Next in the program, I invite our beloved teacher, Professor Resmi CR, HOD of Community Health Nursing, to felicitate the function. Ma'am, please.
Thank you, Sheena. Very warm good morning to the respected principal, Dr. Lieutenant Colonel Rosie K.O. Madam, Vice Principal, Professor Kavita B. Madam, dignified resource persons, organizers, and delegates of today's webinar. It's very great pleasure and honor for me to present a felicitation speech on this day. As we all know, forensic nursing is a new scope of nursing era, and a forensic nurse can work in the variety of fields. And we know forensic nurse is a registered and advanced practice nurse who are received specific education and training. But still, we are confusing with in-depth knowledge about the topic. So today, I'm sure that at the end of the webinar, everyone will come to know the scope and fields of forensic nursing. Here, I congratulate the organizers, the fourth year BSc nursing students, and the steering hands behind the webinar for selecting such a wonderful and relevant topic in the light of new BSc nursing syllabus. Once again, I wish all the very best and success for this national level webinar on forensic nursing, seeing the unseen. Thank you and have a nice day.
Thank you, Madam, for your blessings. Now, before entering into the session, a few instructions to the delegates. If you have questions or doubts during the presentation, please post them in the chat box. We will find time for them at the end of the session. Kindly mute your audio during the presentation. E-certificates will be provided to the participants after submitting the feedback form. All participants are required to fill up the pretest form. The link has been posted in the chat box. Everything is a self-portrait, a diary. Your whole drug history is in the strand of your hair. Your fingernails, the lining of your stomach is a document. The callus on your hand tell all your secrets. Your teeth, your accent, the wrinkles around your mouth and eyes gives you away. Everything you do shows your part. This is snippet of forensic science. The first session of our webinar is forensic science, an overview of concept and importance. To orient us to this topic, we have a highly distinguished expert in the field of forensic medicine and toxicology. Let me introduce Dr. K. Uday Kumar, MBBS MD, Professor and Medical Superintendent, Father Muller Medical College, Mangalore. Dr. Uday Kumar is an eminent personality in our related topic, has numerous medals of achievement up his arms. He has published more than 10 research papers and articles in various national and international journals on themes such as roles of forensic medicine in crime detection, estimation of fetal age from gallbladder length, decalcification of human skeleton in flowing water, menarche and epiphysis closure, and safety measures in petroleum organizations. The dignity has attended workshops on variety of topics like crime among youth, bioterrorism, cybercrime, ethical issues in biomedical research, autism spectrum disorder, drug addiction awareness program, and ABS standards, etc. His papers on estimation of fetal age from gallbladder length was awarded for excellence by Karnataka Medical Legal Society. He is very much active in lending his hand in social work activities in Mangalore and Dakshin Canada, representing the state government. He has decorated many posts such as guest lecturer, resource person, guest of honor, and expert committee member related to criminology and forensic studies. It's my utmost pleasure to invite Dr. K. Uday Kumar to take over the session. Over to you, sir.
Can you hear me?
Yes, sir.
Yeah. Yeah, can you see now?
Yes, sir. Yes.
Yes, sir.
My presentation is, you should be able to see.
Slides are visible, sir. Presentation is visible, sir.
Pardon?
Slides are visible, sir.
Not clear?
It's a clear, sir. Slides are clear only, sir. Visible.
Okay, okay. Now, shall I start?
Yes, sir.
Okay. The very, very relevant, good morning to all of you. A very relevant topic, forensic science, concept and importance in overview. I think all of you must have heard about this word forensic science or forensic medicine or forensic at least. In these days, TV serials you see many places in forensic detection, crime detection, isn't it? So very interesting also. So it is worth going through the overview of this topic. As I was introduced by your thing, I'm Dr. Uday Kumar. Now, what is this? What does it look like? I mean, you can easily say it is a parrot or specifically mako, isn't it? A type of parrot, a bigger size parrot sitting on a stump of a tree, right? Very beautifully colored, blue and red. Am I right? That's the fact, what you see. Okay? Now you see what is it. Now can you see? This is a lady who is sitting on a stump with a folded leg, right leg. Left hand is also folded on the head. And it is a human being. It's not a parrot. But the painter has beautifully painted as a parrot. Right? This type of things you must have seen in plenty, especially these days in social media. Right? So this is the truth. Right? So basically, we are looking for truth from the facts. Right? A layman looks at something and that is the fact. There is a difference between fact and truth. Remember, the fact is what you see. The truth is what is the ultimate fact. What exactly is the truth? Okay, and a criminologist or a forensic expert always, or a police, crime detections always looks at the truth, not the facts. Okay. So now coming to the forensic, the word, how it has originated. See, what you see here is basically a painting from old time. There is a tree under the tree there is a place where people can sit, right? And a village head is sitting on the podium. Of course, there is a lady also. So there is a lady empowerment. You can see even those days, right? And somebody is presenting something. Probably they are discussing over a matter, isn't it? In a village setup, there was no police station, there was no court, there was no administrative body, right? Usually the village headman used to sit and listen to the problems, and they used to dispense justice both on criminal and civil matters. Okay, this is one such situation where it's going on, right? It's a meeting place. A meeting place, in old terminology, it's called forum. Forum is a place where people meet and discuss over the issues. Okay, there is one more like here. Probably it's your own state, Kerala. Probably there's a huge tree and a podium, and people, village head is sitting on the podium, and right. This from the word forum, we got this word forensis. This is a Latin terminology, forum, forensis, right? And it was later converted to English by forensic, right? Now you know from where this terminology forensic came from. Forensic came from forensis. Forensis has come from forum. It's a meeting place, right? Now coming to the forensic science per se. What is forensic science, first of all? It's a vast science which deals with detection. A vast science which deals with detection, right? Finding out the truth, as I told you. Now, a forensic scientist or a police or a forensic expert requires to analyze minute things, microscopic things, which he gets in the bargain of crime detection, and he has to take it to a forensic science laboratory, right? Suppose you see your Kerala state, you have a central forensic science laboratory and regional science laboratories, right? It's a big setup by the state government, under Home Ministry. So there they analyze all these minute things which you get in the course of your investigation, right? Forensic science laboratories. Okay, whenever you get an article or a material of evidentiary value, right? You have to collect it, you have to pack it, you have to dispatch it to the central or regional science laboratories. Okay, there they analyze and tell us what is it. Okay, so if you see forensic science department, there are so many other subsections. There are plenty. I just to name few. Forensic toxicology, you must have heard about it. In your nursing profession, it's very relevant also. What they do is, suppose a patient comes to the casualty with the signs of poisoning, or you suspect poisoning, let's say. What do? You give a stomach wash, or if he vomits, you collect the vomitus and preserve it in a bottle, pack it and send it to forensic science laboratory for analysis for legal purpose. Now that is dealt in toxicology, all about poisons, detection of poisons, quantity of poisons, both qualitative and quantitative analysis of the poisons are done by the forensic toxicologist. It's a section in forensic science laboratory. Then forensic ballistics, again, very interesting field. Suppose a person has been shot by a bullet and he is in the hospital, and doctor by doing a surgery, he removes the bullet from the body and hands over to the sister or a nurse. Most of the time, what you do, you keep it aside and somebody will throw it off. The ayah will come and take it off, thinking that it is a waste. But it's an important part of evidentiary value, right? So it has to be collected, packed, and given to the forensic science laboratory for analysis. Okay, that's forensic ballistics. These ballistic experts will examine the bullet. They will tell whether it is a bullet or not. Then they will say from which firearm, which gun it has been fired, and they will identify exactly from which gun it has come from. right? That is ballistics. Then chemistry. Various applications are there. Any chemicals you get in the scene of crime, it has to be collected and sent to the forensic science laboratory for detection of what is the chemical. Suppose there is a bomb explosion, right? So the chemicals, the bomb will have so many chemicals. So those chemicals may be spread around the scene of crime. That has to be collected and sent, and the chemistry people will see what is that particular chemical. Forensic biology. It's again a very vast field. A lot of things are seen here. It may be forensic. You must have heard about these days. A lot of importance has been given to chromosomes, right? Detection of every person by their genetic print, right? It's called DNA fingerprinting technology that is done in this biology section, right? From a drop of blood, a drop of semen, a small piece of bone, people take up the genome, the genetic material, chromosome from that tissue, and it is analyzed. They will tell this particular blood belongs to this particular person. It is very important in criminalistics for identification of a person. Then forensic physics, they see a lot of physical aspects of physics application, right? Then finally, we have forensic medicine. We are all interested in forensic medicine because all these things which are shown in red and so many other things are done by the experts of that particular field, whereas forensic medicine is restricted to whom? Doctors and nurses, right? Medical people. Medical people, when you say medical people, it is not just doctors, it is doctors and nurses. Always remember, because if there is a patient who is a human being, right? He may be a victim of a crime or a victim of an accident. He may be a victim or an assailant. Assailant means who has performed the act, right? So who is the best person to understand a human being? It's doctor or nurses, because we interact them in fact, between the doctor and nurses, I would say nurses can get a lot of information from the patient than a doctor, especially connected with these crimes and other things, because a doctor interacts with a patient only once or twice a day, morning rounds, evening rounds maximum. Whereas nurses, they interact on 24 hours, right? So they become more pally, right, with the patients and more attached to the patient. So patient or the patient says a lot of information to the nurses, and in fact, we get a lot of information from the nurses regarding the incidents and other things, right? Now, coming to the forensic medicine, what is it? How it is useful in the legal system. The definition goes like this: application of medical knowledge in the administration of justice, right? In legal matters, how we can help as a doctor, as a nurse, or a medical team. Doctors and of course nurses are the most important part of this administrative. We can help the administration. Okay? So don't think it is the job of the doctor. I am nothing to do with it. You nurses play a major role in forensic medicine. Coming to the most important thing, you must have heard about this in your clinical practice, in your profession. I think any patient coming to the hospital through casualty or OPD or anywhere. So the most important point we discuss is this: an MLC, right? By now, all of you must have heard about this. What is MLC? Medico-legal case. Why I am stressing upon this? All your legal responsibilities comes with MLC cases only. It doesn't mean that non-MLC cases are not important, but it is of lesser value. Whereas when it comes to MLC, medical legal case, the role of the medical team, doctors and nurses, plays a major importance in administration of justice. So what we have to see, or how do you say a particular case is a medical legal case or just a plain non-medical legal case. So, in fact, most of the time you see the patients first. You inform the doctor. The doctor, there is an MLC case. In fact, you are deciding that whether it is an MLC or not. So, what are a medical case with legal consequence? Medical case with legal consequence. What is it? Basically, a patient coming to the hospital, but this patient may land up in the court of law tomorrow. Patient may land up in the court of law tomorrow. The case, right? It has got legal consequence, legal implication, legal nature. Okay? So when I give you the examples, you will understand better. RTA, very, very common thing. In a road traffic accident case, comes to the hospital. What you do? Immediately you know this is a case of MLC. How do you say it's an MLC? You know very well that most of these cases land up in the court of law for what? For legal matters like compensation, right? Insurance claims. Then also criminal case against the perpetrator of the crime. So RTA is undoubtedly a medical legal case, right? Assault case, adibadi. If somebody hits someone and that victim comes to the hospital, even assailant also may be coming to the hospital. He also may have some injuries. So such cases are undoubtedly medical legal cases. And next is poisoning case, right? Why poisoning case? Because as per the law, 309 IPC, attempted suicide is an offense, right? And also you don't know whether it is a suicide, accident or homicidal. Somebody has put poison to somebody else. So it becomes an MLC. Okay. Trauma, any trauma, they fall from height or anything, machinery accidents. He was working in a factory. The hand is crushed by the instrument or something. So that becomes a medical legal case because a lot of compensation is involved in it. Suppose, let's say, a person's hand is cut off, right, by a machinery. So the owner of the company should pay him the compensation because he loses its earning capacity, isn't it? So suicides of any kind, right? Attempted suicides, right? Suicide means, person is dead. Right? I'm talking about attempted suicide. Even death case suicide, that's when it comes to MLC, it has to be MLC casualty. Bites. Bites means, bite of any dog bite, right? Animal bites, stings, bee stings, snake bites, right? Even animal bull gore injuries. All these are medical legal cases. You may ask me, suppose a snake is bitten. A snake bites a person, right? A person is bitten by a snake. Now, how it is going to help? Are you going to make a case and punish the snake? No, it's not like that. You don't know whether it is a suicidal, accidental, or homicidal this thing. And let's say it is the responsibility of this. Let's say a person has gone to somebody's house and a snake bites, right? He can bring about a legal action against the owner, right? A owner is expected to keep a clean environment without snakes. So these are the responsibility of the owners. Let's say a street bull gores a person, right? And it becomes the municipality's job to keep the bull out of the town, isn't it? So these are the responsibilities of the owners, and if they err it, right? So they will be punishable. So sexual assaults, right? So this is also a very common area where these days a lot of small children are coming with sexual assaults, sexual harassments, right? So when you know about that, when you hear about it, and females easily open up with the nurses about. In fact, so many cases. We admit the patient for some injuries and things like that, but later sister comes and tells us, sir, there is a problem. It looks like somebody has harassed her sexually, this, that, and all, right? So we get the information from the nurses about this, especially in connection with sexual assaults. So all these are considered should be medico-legal case, because all these cases will land up in the court of law, or chances of landing up in the court of law tomorrow. That's the legal consequence or legal implications or legal nature, right? So you have to make it MLC. Okay, now question is how to make it MLC. What is it? You heard about this medical legal register? Every emergency setup, casualty, or every hospital has got a medical legal register. This is a nothing special. This is a bounded register, which is seen in casualty, which is serially numbered. A bound book, usually about 200 pages bound book, which is serially numbered. On the top hand, right hand side, you can see in red ink, it is numbered 1, 2, 3, 4, 5, 6, up to 200. Because 200 pages, 100 sheets. So, and just it is not a serially numbered book, it is sequentially entered book. You make entries sequentially. Sequential entry means chronologically. Today, the case is entered today's date. The next case will enter on the next page, not on the previous page. Right? It should be sequentially entered. Why it is so important? Why not haphazardly enter here and there? What is the problem? No. Once you enter in a serially numbered book sequentially, it becomes a legal document because you cannot manipulate it, isn't it? Suppose you cannot add something tomorrow, right? It has to be entered in the next day itself. So you cannot manipulate this register. That's why it's a legal document. The credibility of this document is very high in the court of law. Okay, so this is medical legal register. Then you may ask me, what about a case sheet, case papers in the hospital? Is it not a legal document? No, it is only a document. It's a medical document, right? It is only a medical document. This is also admissible in the court of law. The credibility is low. Why? A case sheet can be manipulated, isn't it? You remove this page and put one more page there. You write it. So you can manipulate at the later dates, right? So, but whereas the medical legal register, you cannot manipulate it because it's already filled and it's bound, right? It's very difficult to manipulate. Okay, that is a legal document. And in a medical college setup or in a hospital setup, there are two registers. One is medical legal register kept in the casualty or emergency. The second one is the post-mortem register that is kept in the post-mortem room. These two are legal documents. Both are serially numbered and sequentially entered documents. Just to all other documents, all other registers. For example, your admission register, discharge register, a lot of registers you keep in the wards. All these are not legal documents. They are all medical documents. The role of a nurse. What is the role of a nurse? I have already touched upon few things, how important nurses are in medical legal cases. So you work in casualty, okay? You work in OT, high dependency units like ICUs, MICUs, SICU, PICU, NICU. Then of course, wards, especially psychiatry ward. See, when you work in these areas, these are the most important areas where you come across medical legal cases or forensics, right? In casualty, I told you, all these trauma cases which I mentioned, RTA, bites, trauma, poisoning case, everything comes to the casualty. As a casualty nurse or a casualty in charge, you have to be careful in looking at each and every case, not only from the medical point of view, you should also look at it from the legal point of view. And in a casualty, let's say, an assault case comes to the casualty, right? Person is brought in a wheelchair or a stretcher, wheeled down to the casualty. So what are you going to do? Right? He has been stabbed on the abdomen, let's say. So you should know that this is a medical legal case. It should be entered in the medical legal register, right? There may be a junior doctor. Ask the junior doctor or CMO if he is there, he will know usually, right? He will take care. Otherwise, you should tell the doctor to enter in the register, right? And most of our nurses knows how to enter in the register also. What are the ingredients of the register? Actually has to be there, right? Who has brought him to the hospital, right? And then in the register, and you may have a register. Then, not only that, so in the casualty, what do? You take his clothes off and you put the hospital gown, right, to the patient. What happens to his dress, let's say? You put it to the side, right? Or if it is soaked with dustbin, right? So that should not happen because the clothes are very important part of evidence. Suppose a gunshot injury, let us say, the cloth will have gunpowder. So from that you can see from what distance he has been fired, right? So many informations you are getting from the cloth itself. So you cannot destroy the cloth, or suppose you throw these evidentiary materials, maybe cloth or bullet or whatever it is, right? Tomorrow it will be you will be subjected to concealment of evidence. It's a serious offense, okay, and you may be punished in the court of law, right? So it's of utmost legal responsibility lies with you. So all these materials of evidentiary value may be cloth, only you open a shirt and take belongings. These are all important material. Gold, cash. What are you going to do? You have to document it in the case sheet. What are the things you are in the presence of another nurse to the concerned authorities. So this in the casualty level. OT level, I have seen. I particularly I remember a case where a person stabbed and it was stuck to the skull bone. And in the surgery, in the OT, the surgeon opened it and gave the tip of the knife to the sister, assisting nurse. She kept it in the bowl, and later it was destroyed. Destroyed means somebody else threw it off, right? And police came and asked me because they had caught hold of the knife. Knife did not have the and removed in the OT. It is mentioned the out of the scrubners destroyed it. Now it became a very sensational case in the court of law. Later, I had to go and substantiate in the court. It's not only on the nurse, it is responsibility on the hospital also. I had to represent. These things can happen, right? So anything recovered from the patient body, whether it is extraneous material or internal material, even a small tissue removed from the body should not be thrown out. It has to be collected. So many times it happens, they take out the sample, and I was talking about like ICU you may get, and a lot of materials of evidentiary value you may receive. Don't throw it. You preserve it. Then the wards, especially psychiatry, I have mentioned because psychiatry patients usually open up with the nurses. So many things So it is nice for the nurse to be interacting with the patient and get informations about the problems which will help in solving the. In fact, I wanted to go and see him. Patient was on the bed. I could see him through the window. Right, he was talking to. Moment I just called up nurse and asked which is the patient. He understood that somebody is coming to see him. Immediately he slept on the ward and acted as if he's semi-conscious. The nurse told me when I had a patient, so sometimes he's absolutely normal. How to dry it? You can't put it under sun. You have to. It's called shade dry. In a shade, you dry it. Once it is dry, pack it nicely and then hand it over to the police. Hair, again, similarly like blood, a person may have hair on the body which may belong to him or it may belong to the other person. So all these things have to be collected. Vomitus, stomach wash, right? In poisoning cases, has to be collected in a bottle. Swabs, I told you anything. Suppose a person have swab stains on the waist area. It may be seminal stain, right? You collect the seminal stain. You are examining. If you collect it with the wet swab, right, and put it. write and put it in this thing. You can identify a case of the seminal state. Identify the assailant. Okay, and it is a very important piece of evidence. Only you can collect it, you can identify it. Okay, if you clean it and throw off these things, the most important material of evidentiary value is lost. Article I told you, anything which is seen with the patients, either in the pockets, all these things are evidentiary material. You cannot neglect on this. You have to collect it and keep it for examination. Washings, I told you. Now you know what are the things you have to collect. You have collected. Then I told you how to collect it. Anything in wet form, you can take in wet form, right? You can take a dry swab, dry form. You take a wet swab and transfer it. It's called stains to the swab, right under the fan, pack it. Okay, that's collection, right? Collection depends on the material, right? And you have to preserve also. In all MLC cases, you have to collect the MLC cases, collect the blood for grouping as well as a sample. How do you collect? Today we have vacuum. No, don't freeze it. Keep it in the regular ask CMO what to do with this. Right? All those wet things, right? Liquid is like that, blood collecting from the vein. Okay, refrigerator, packing. Okay, because there is some material of evidentiary value, right? A small piece of a small article, right? It has to reach the forensic science laboratory without anybody's manipulation in between. You are collecting, you put it in a container, seal it, cover it, seal it, then sign it so that nobody can open it. I'll show you how it is done. That's called packing. Packing is an important thing. And most of the time, doctor will ask you to pack it and send it. So you should know how to pack it. Then, of course, storing two things. One is refrigeration is also storing. Second thing is some articles. Where do you want to store it? You can't keep it in your document. You should not miss any of these things. If you miss any of these things, I'll tell you, you will be spoiling the case, right? Dispatching to the wrong person. If you don't document, you don't store it, don't pack it, don't preserve it, and of course, don't collect it. What happens? Concealment of evidence, right? Now see how we have packed. We have collected something in this container. It has got a lid. We have closed with the lid. After the lid, we have not kept it like that. We have taken a cloth, right, and tied it like this at the neck and at the top. and there is a wax seal all over the thread, you can see. Now, what is the advantage? If somebody opens it, the seal will go. It is a wax seal, it will powder, it will cut off. Then how to do it? It has got a print also, I'll show you. See what is there on the top? It has got a print. It is your unique seal which you will have, and with the help of that seal only, you can pack it. Okay, you can seal it, right? And nobody else will have this seal. Okay, so this is how it has to be sealed. It's a metal seal basically, and here wax, you melt it and press it over this thing. It will stick there. It won't go anywhere else. See how nicely it has come, right? And nobody can open it, nobody can tamper it, nobody can manipulate it. Okay, this is a packing and sealing part. See, this is an envelope, right? In the envelope, we have put something, we have put a gum, and finally we have put sealed. You can see how we are sealed on all the junctions, because nobody should open it, right? With the help of a sharp thing, you can open and change the article. But now what happens? You cannot open it. But there's a better method now. This is the old method, wax seal. See, this is a method. This is also an envelope. See what I have done. I have signed over the junctions, and I have put a transparent sellotape. Transparent sellotape, right? If anybody wants to open it, he has to cut it. You will know that he has cut it. Or if you want to pull it, your sign will come with the sellotape. So this is a better way of doing sealing part, especially with envelopes, right? Where you can seal, you can put your signature, because nobody can change your seal also, signature also, right? And put a sellotape nicely over the area, which your signature is covered by the sellotape, and nobody can open it, right? So this is the way you can seal and sign and seal. Okay, this is called sample seal. You also remember when your article is sealed, right? And it is kept in a bottle or whatever it is, then there is something called sample seal. So take a paper, all these things are written there, what is collected, right? How much you have a stomach, and 30 centimeter of small intestine, all these things have been collected, let us say. It is there in the bottles, 3 or 4 bottles we collect. It's in the postmortem room actually. So the same thing can happen in the casualty also, right? Instead of 4 sample, you will have 1 sample. But you have to put a seal, the same seal which is there on the bottle, the same seal should be there here also in this on this paper. Okay, and this, before they open that seal, the people will identify this seal, and they compare. If it is both belongs to the same seal, then only they will open. That means nobody has tampered, right? So that is the way it is done. It's called sample seal. Okay. Thank you. I think I have covered in almost 40 minutes now. So, any questions?
Sir, and question has been posted in the chat box by Nilaroop.
Okay.
Her question is, when a patient is opening up to a nurse in psychiatric ward, is it okay to report it? Isn't it important to maintain the confidentiality of the patient?
Confidentiality is required, right? But you can divulge the secrets, okay, to the concerned person only, because you are doing in the interest of the society, in the interest of the law, okay? So basically, you can divulge. There is no problem. You cannot divulge to Tom, Dick, and Harry. You have to talk it to the concerned person only, right? This is a medical, whether to make it an MLC or not number in the first instance. If you want to say it's an MLC, then the CMO have to be informed about it, and police will be informed about it, right? The question of confidentiality doesn't arise. It's called privileged communication. there are communications which are privileged, right? When it is done in the interest of the society, in the interest of the law, right? So this can be divulged. There is nothing like professional secrecy in this. Okay. Chat box. I'm not getting the chat box. Where is it?
Sir, there is another question.
Yeah.
Is there any rule or law for who can witness the autopsy or see the evidence?
Is there any rule who can see the autopsy? No, I'll answer that. See, a postmortem is that is a medical legal autopsy. It's a legal procedure basically. It will be done by the medical legal expert in the mortuary, right? Here, authorized person will be the doctor who is conducting the autopsy and the IO. Okay? IO is investigating officer. He can witness the autopsy. But if a nurse wants to see, definitely he can take the permission of the doctor and the IO and he can witness with a specific reason, right? It's a confidential thing, procedure. So everybody coming and witnessing and going and talking outside will create problem. So that's why it is not allowed. Okay.
Okay, thank you, sir. There's another question.
Is there a collection of now I am getting it questions. Whether it's the job of the nurse or the doctor, isn't it? That's a good question. I was expecting this. See, there is nothing like doctor has to collect or nurses have to collect. It has to be collected. That is the first thing, right? Why nurses have to collect? Because they are the one who gets all these information first. I told you, in an emergency setup, in a casualty, the patient comes, right? Doctor may take few minutes to arrive, isn't it? So, most importantly, the nurse who takes the cloth out, I told you already, or something which is there in the article, all these things are taken out by the nurses only. Right? Then when you have taken up, it becomes your job. Then, of course, you talk to the doctor or hand it out. The doctor document it that it has been handed over to the CMO. Fine. But the main collection part, it will be the job of the nurse. Right?
Thank you for answering the question, sir. It
Yeah.
was a highly enriching session. Your knowledge and experience in this field shared with us is highly resourceful for our studies and future career. As a token of appreciation, we would like to award this certificate to you. Thank you from the bottom of our hearts.
Thank you, madam. Thank you, all the viewers.
Okay, thank you, sir. Thank you. The next session is on the topic forensic nursing, roles and responsibilities on comprehensive care of victims and family. We have a distinguished person on this topic, Mrs. Sheba Joseph, Senior Nursing Officer at Jayaprakash Narayan, Apex Trauma Center under All India Institute of Medical Science, New Delhi. Mrs. Sheba Joseph has completed Masters in Social Work in Counseling from IGNOU Delhi. She holds a fellowship in emergency nursing by Academy of Clinical Emergency from AIIMS. She has been a member of professional organizations such as Indian Society for Trauma and Acute Care and Trained Nurses Association of India. She's having 25 years of clinical experience as a senior nursing officer in radiology department and interventional suite in JP and Apex Trauma Center. She is recipient of awards and accolations for outstanding performance in COVID-19 care, Memento of Appreciation for Corona Warriors, Rajiv Gandhi National Excellence Award, etc. I heartily welcome Mrs. Sheba Joseph to take over the session. Over to you, ma'am.
Thank you, Sheena, for the invitation. I am good. A warm good morning to one and all. First of all, I would like to thank Dr. Lieutenant Colonel Rosie K.O., Principal at Ashwini College of Nursing, and Organized Secretary Professor Kavita B., Vice Principal Ashwini College of Nursing, and the entire team for organizing this meet. It's my immense pleasure to deliver a presentation such a relevant topic on this honored platform, along with other dignitaries. Let's move on the topic. Forensic nursing is relatively new specialty recognized by the American Nurses Association in 1995. Initially, forensic nurses focused primarily on sexual assault, assessing victims for mental and emotional trauma.
Madam, sorry for the interruption. The PPT is not visible.
Forensic nursing is relatively new specialty recognized by the American Nurses Association in 1995. Initially, forensic nurses focused primarily on sexual assault, assessing victims for mental and emotional trauma and using their psychiatric and medical knowledge to help victims feel more comfortable answering police questions about the attacks. History of forensic nursing. Foundation in 18th century. Certain medical professionals were involved in court cases that involved crimes like rape. Began to move these issues to more recognized health concern. Virginia A. Lynch, mother of forensic nursing, is a strong advocate for the forensic nursing specialty in United States, pushed to have the specialty recognized and helped to form program in the US for proper education. In the 1980s, articles were being written about how the important evidence needed to build a legal cases was not being preserved during the treatment of victims. Development of forensic nursing in India, introduction, awareness, and reinforcement. In 2002, forensic nursing was introduced in Government College of Patiala. Mrs. Virginia L. Lynch was chief guest on that program. Then established the subject on the other local colleges like Dayanat Nursing College, Guru Har Sahi Nursing College, and Ramdas Nursing College, Government Nursing College. Then they started the workshop and courses for rape victim examination workshop, crime examination. In 2007, forensic nursing was founded in Gyan Sagar College. First forensic nursing in India is Miss Nisha Bharti. Forensic nursing in India, in new scope in nursing is emergent in the Indian scenario. It is a forensic nursing. Its field was already gained its momentum abroad, but it is yet to set its foot in India. The Indian Nursing Council was included forensic nursing as a subject in the revised syllabus of BSc nursing program in the 5th semester in this year. What is forensic nursing? Forensic nursing is defined as the application of the nursing process to public or legal proceeding and the application of the forensic healthcare in the scientific investigation of trauma and or the death-related abuse, violence, criminal activity, liability, and accidents. What is the importance? Actually, Dr. Udayamas has already covered, but in nursing side, I'm going to tell their medical expertise combined with the critical thinking and proficient communication skill ensure that their cases are solved truthfully and lawfully. They also help the victim and family to abuse violence, seek relief, comfort, and justifies. It relieves the emotional strain of institutions that are trained to respond appropriately to the psychological impact on an incident. Forensic may be a recruit to identify, the determine, and explain the certain cases involving the physical abuse, trauma, and fraud. Application of knowledge and knowledge of nursing practice to solve the medical legal cases and help the criminal investigation system and judiciary. What is the scope? Forensic nurses are practicing in the hospital and out in the community, making a difference in people's lives. They identify issues that will have a legal impact on society. They work with grieving family members when death comes unexpectedly. Forensic nurses contribute to disaster planning and response. Moreover, there is an injury or potential for injury, there is a role for the forensic nurses. What area we want to practice? Trauma units, burn units, medical surgical units, forensic death investigation teams, victim assault departments, prisons, medical examiner office, state attorney offices, counseling facilities, legal consulting, and FAMES. What do forensic nurses work with? Who do? Forensic nurses work on cases that involves domestic violence, sexual assault, child abuse, and elder mistreatment or in disaster nursing. Forensic nurses work with many health, legal, and business professionals. It includes the law enforcement, lawyers, jet, forensic partners, funeral homes, pathologists, and medical experts. The nurse's crucial role. Without a proper training and understanding, the nurse and the other personnel can potentially damage sensitivity evidence if protocol and procedures are not followed. Whether the nurse is trained as a sexual assault, nurse's examiner serves in another capacity, understanding and importance of the evidence collection in sexual assault cases is crucial. Through the education and training, general nursing staff can be assessed trained personnel in a treating and supporting victim and preparing for a crucial evidence collection. Already Sir said what is evidence collection and everything. In the 25th century, a highly educated nursing workforce is central to the delivery of high quality evidence-based, compassionate, and through the sexual assault evidence collection and patient care. What is the ethical parts of nurses and the patient rights? The American Nurses Association see advocacy as integral to the nursing, and one of the basic tenets to nursing advocacy is the patient right to make decisions that affect his health. For example, the nurse should support and alert competent patient who refers his medication or chooses not to have a particular medical treatment. This may mean taking a position that physicians see as adversarial, so good communication skills, tact, and honesty are critically important to the practice of patient advocacy. The nurse role in such situation is to provide information that helps to patient make decision and to seek upon the support for the patient as necessary. Ethics and patient advocacy, sir, is already said. The nursing ethics are arise from the principle of non-maleficence and or not doing harm. Used under this principle, nurses have a duty to treat people with compassion and to respect inherent worth and dignity of each individual. Victims of abuse have been violated in the physical or sexual or emotional ways. nurses are expected to deliver care no matter how difficult or how they are ugly or what is the situation. Nurses have an ethical expectations to be advocates for their patients. Ethical rights of survivor. Nowadays, we can't say victim, we need to be say survivor. Right to personal dignity, right to individualized care, right to assistance on towards independence, right to complain and obtain changes in care, right to stop physical examination. The nurse need to follow the continuum of care. What is mean by continuum of care? Protecting patient from head to toe. That means on arrival, interview room, receiving time, one-stop room. That means emergency room. We have one separate room for one-stop room, and we are calling when they are arriving. We need to inform the gynae people to come and check in that room, special room. Admission, operating room, intensive care unit, isolation room, comfort room, discharge or death, court, rehabilitation, and follow. On arrival time needs to be intimated to hospital administration, police, and gynae doctors. Arrival of the victim should be intimated the nurse at the administrative level and the police section or area investigating officer and on duty doctors, gynae, and CMO with proper recording of date, time of arrival, condition of the survivor, vital signs, etc. The identity of the person accompanying, who may be accompanied with that patient, we need to ask the name and take original ID proof of that person. Different roles. Subspecialty of forensic nurses is the same, different roles. Clinical forensic nurses, forensic nurse investigator, sexual assault nurses examiner, legal consultant, death investigator, interpersonal violence nurse clinicians, coroner legal nurses, consultant nurse attorney, forensic nurse educator and consultant, forensic psychiatric nurses, forensic community mental health nurses, forensic pediatric and geriatric nurses, forensic emergency nurse specialist, and correctional of prison nurses. What is sexual assault nurses examiner? When the patient is suffering from the injury, forensic nurses fit focus to identify, diagnose, and treat the injury, collect the forensic evidence related to the report, crime, and frequently testify as a witness to substance trial, conduct through the examination and history of the crisis intervention, referral evaluation of the victim for STIs, pregnancy assignments and care. We need to ask about the client. Sexual assault nurses examiner provide emotional support and compassion to the victims. The present information answers questions, performs examination and interview witness. These all are the SNA's roles. The only focus on the physical signs, but also a patient verbal tone and behavioral action should be followed. Ensure that the patient can physically recover and stabilize their conditions. Moreover, in a case of sexual abuse, forensic nurse may do a vaginal exam to look for penetration, semen, and other forms to sexual assault. This part is also death investigator nurses also looking for the probable cause of death. Who is forensic nurse examiner? Forensic examiner have a variety of responsibilities such as treating and educating patient, examining prospective suspects of part of an investigation, providing crisis intervention of two patients, using forensic photography and recover evidence, referring patients to ongoing programs. Who is nurse attorney? Nurses have a long been responsible for the practice of patient advocacy. Supporting the interest of another person in a law advocating means pleading another person cause in front of a formal tribunal. In nursing advocacy may mean managing logistics, translating medical terms, or dealing with the ethical issues. Not an advocate. There are many types of advocacy in nursing, and the bedside, that means, simple example, the bedside caregiver who spends much time with the patient, a nurse is specifically positioned to be an advocate. Patient advocacy is also one of the ethical expectation for the nurses. May be involved in like serves as a legal consultant, helps hold accountable poor practices who are dangerous to the clients. Testifying in court. Forensic psychiatric nurses cannot act advocate for victims of for family member and don't provide long-term treatment for them in the way psychologists or psychiatrists would. Instead, they are called as experts to assess the statement of mind of both victims and offenders. The court, they may testify regarding the suspect demander, such as if he seemed remorseful for his action or he seems to understand the difference between the right and the wrong. Death investigation nurses. Actually, we are not practicing the coroners. Coroners are essential. The coroners are not in India. Before that, Bombay or Mumbai, some other states they have, but nowadays there is no state is having coroners. But the coroners are essential in providing forensic nurses, law enforcement, and crime sciences investigation within the information regarding the victim, time, and cause of death. In some cases, forensic nurses are the only one who provide the information needed to solve the crime. It allows them to bring their medical knowledge and training into the autopsy to understand the situation better. Forensic nurses, death investigator respond to crime scenes and would work directly with the law enforcement with the death cases. To gather information, they interview possible witness, research the victim's medical history, identify the circumstances leading to the victim's abuse, death, and they provide support to grieving family member and friends. Nurses coroner. Nurses coroners are responsible for ensuring that appropriate measures were taken to perform death investigation and clarify the death certificates. Uses nursing knowledge to identify the diseases process that they lay coroners may not be recognized or may misinterpret as foul play. Legal nurses consultant provides assistance within the legal system using specialized nursing acknowledge and expertise. Evaluate, analyze, and renders informed opinion on the delivery of a care and its outcomes. Service and activities of licensed nurse. Identify, organize, and analyze the medical records and related materials. Prepare chronologies or timelines of death care events. Identify the applicable and standard of care. Evaluate and damage issues. Conduct literature and research and summarize medical literature. Evaluate case strengths and weakness. Clinical forensic nurses examiner emergency and critical care. Deliver care to the both living and deceased clients. Identify the forensic cases. Initiate the proper collection, preservation, and chain of command of evidence. The clinical forensic nurses examiner organ and tissue donation and transplantation. Conduct and provides detailed physical exam and collects any evidence that may be required. Identifies acceptable candidates and potential organ and tissue for the harvest. Forensic psychiatric nurse connects the gap between the criminal justice, legal, and mental health system. Applies nursing process to client pending a criminal hearing or trial. Correctional nursing. Correctional nurses are forensic nurses who work in jail, prison, or juvenile detention centers. Recognize safety and security issues for the nurses. Always maintain an escape route. Understand the prison culture. In prison, addressing the health issues in the prison population, and the healthcare triage process includes physical and mental health histories. Care includes chronic and communicable disease, HIV, need to ask any tuberculosis there, like that. Impact of drug use and victimization. Mental health issues of correctional settings, adjustment to incarceration, is extremely difficult to many mentally ill individuals. Assistive mental health treatment and medication is a right of prison inmates. Then the forensic nurses' responsibilities. Providing expert forensic nurses consultation, maintaining confidentiality and compassion at all times, collecting blood, tissue, and semen samples, evaluating and documenting patients' wounds and injuries, gather evidence from the victims and the suspects, managing the victims' emotional and trauma, fear, testifying in court as an expert witness using evidence gathered, conducting the forensic photography, serving as a bridge between the healthcare and the legal system. Like most areas of nursing, forensic nurses can have a different daily task depending on where the work and what type of forensic they do. Treating crime-related injuries, serving, consulting with and providing support to the victims and families, collecting and preserving evidence such as photographing injuries and saving turned clothing to be used in court, working with the communities to provide anti-violence education and advocacy. Responsible forensic nurses are empathetic, team player, problem solver, dedicated, and honorable. Comprehensive forensic nurses care of the victims and family. Medical care. How medical care is used in the forensic nurses resumes. Coordinated medical care evacuation for critically sick and injured patients, providing timely movement to higher levels of medical care. Reviewed physical needs, monitored patients' physical condition, and arranged medical appointments according to assigned medical care standards. Clinical work. Same as the SNA, sexual assault nurses, the nurses' job descriptions, clinical side. What does sexual assault nurses do and advance the physical health and well-being victims of abuses? Next is advocacy and legal works. In addition to providing clinical diagnosis, forensic examination, and medical treatment, the sexual assault nurses may offer important legal support and general advocacy. Example is sexual assault nurses' job description may include the following: connecting patient with the community resources such as mental health provides legal advocates, serving the legal witness, providing expert testimony during the development of court hearings, maintaining the chain of custody for sexual assault examination, and adhering to all legal guidelines regarding evidence of the obtained document and storage. Preparedness for the forensic care. Emergency department prepares for forensic care varied and was often limited to women and children. Primary survey, taking care of the patient's immediate medical and psycho-social needs is always the highest priority. Primary surveys, ABCDs, are the priority of care, preservation, and evidence as follows. What is airway? Patency, foreign object, obvious injuries. It may consider, we need to consider the cervical spine with patients of possible trauma or assault, preserve unusual foreign objects. Breathing, effectiveness of integrity of the chest wall, tracheal deviation, especially with the victims of an assault. We need to care about these all the things. Do not cut, and next is do not cut through bullet or knife track in cloth. Even if you are cutting, that proof, that evidence will be removed. So you need to cut that cloth. Anywhere the bullet and cuts or knife tracks is not there, this separate area need to be cut. Don't cut that bullet area. Label and certain any unusual objects or scratchings. Circulation and perfusion. Pulse rate and quality skin color and temperature and capillary refill. Alterations in assessment may indicate blood losses with patients of assault. Assess for sign of uncontrolled bleeding. Assess for occult bleeding such as abdominal distension, sign of head injury. Evaluate Heart rate could be due to emotional response to the event. We need to check all the vital sciences. Then medication, street drugs or volume losses. Do not clean injury sites at this time, and that that cleaning part need to be preserved for an evidence. Disability. Alteration in level of consciousness may indicate head injury, physical, emotional shock, presence of medication and street drugs. Does the patient appear to be a dissociating? Are they occult or obvious head wounds? We need to check. Exposure. Carefully remove the clothing and preserve as evidence documentation for injuries. Remove clothing intact if possible and place in separate paper bags. Already said. Careful and thoroughly document injuries. Keep patient covered to prevent heat losses. The next one is full set of vitals and family presence. If we are taking the vital signs, obtain a full set of vital signs, facilitate family presence. Otherwise, some of the cases, family can blame you. Get registration adjectives, LMNOP. Laboratory analysis, blood typing, blood gases, lactate and cardiac monitor. Consider naso-orogastric tube. Using appropriate pain scale assess for pain management. Non-pharmacology comfort measures, analgesic pain medication. Then any hemorrhage is there, we can send for fast examination. Secondary survey. Identify all the injuries, secure the scene, collect baseline laboratory specimens, obtain thorough history, only ask for details necessary to perform medical and evidence for collection tasks, preserve clinical data, collect any potential evidence. Common injuries, physical assault, grab and restraining marks. We need to recheck. Sexual assault, not injuries, or in a sexual assault case, not injuries like to breast, upper portion of the inner thighs, injuries or soreness to scalp back, buttocks, physical assault, grab, restraining marks like neck, arms, wrist or legs, ligature marks, choke and strangulation marks also. Commonly, there is no physical injury with sexual assault. Categories of clinical forensic cases: police, correction, custody abuse, sexual assault, substance abuse, child maltreatment, occupational related injuries, domestic, intimate partner violence, elder abuse, suicide attempts, violent crimes, workplaces. A nurse's role within the victims of abuse and family. Abuse occurs in many areas of society and takes many forms. Situations may involve the abuse of child by a parent, caregiver, vice versa. The abuse of or the spouse also. In addition to the physical aspect, abuse can include the emotional battering, financial exploitation, and sexual assault. Many of these result in health problems over the victim. The nurse role in the dealing with the victim of abusers is multi-faced and result from the ethical expectations, law enforcement activities, and traditional nursing care. While obtaining a victim's account of an incident is crucial to investigating, law enforcement officers also want to avoid inflicting additional emotional trauma. Forensic psychiatric nurses are frequently called into work with sexual assault victims or children to help them feel safe enough to recount what happened to them. Who is a victim? Victim means person who individually or collectively have suffered harm. Victim of violence. Victim of violence may enter the healthcare system in primary care, community clinics, urgent care, and emergency departments. Sexual violence is defined as a many sexual activity in which consent has not been obtained or cannot be given freely. Victims of abuse or neglect. Victims of abuse neglect may come to a hospital in a variety of ways. The patient may be unable or may be reluctant to speak of the abuses, and it may be not be obvious to the casual observers. Staff nurse need to be able to identify the abuse or neglect as well as extend the circumstance of the abuse or the neglect to give patient appropriate care. Identify the victims: physical assault, rape, sexually molestation, domestic, intimate partner abuses, elder neglect or abuses, child neglect abuses. Victim autonomy. The subcategory victims autonomy is about the patient's right to make decision about their care. Whether it involves doing forensic examination, taking photos, reporting to the police, contacting close ones, it is up to the patient to decide. Not to force anything, to tell about the help of fate. The patient can choose what to do with the information. Patient decided how to proceed after being examined and recommended different caring interventions. The patient have the right to stop the exam also. Victim approach is about how nurses feel towards approaching a victim of violences. The review of the patient would not change regardless of whether the patient disclosed the abuse or not. The care is the same to give the nurses. If the patient discloses, it will only add a few more work classes. Sensitive topic and difficult to approach if the patient tells about the involves and seeks help, but does not want to report the care of the patient, and approach is the same as to any other patient. We may not to know everything, but the patient's background. Family members. The quality of care can, however, be influenced by the nurses' attitude about the importance of the family in nursing care. The need for care that encompasses family members can vary and might not always be appropriate or necessary. However, in case whether there is no risk for the victim, involvement of family members in care may strengthen the family or alleviate suffering and emotional distress. Victims and family members affected by the violences. The legislation gives healthcare, included emergency departments' responsibilities are to establish routines for victims of violence in close relationship, to ask the question about the violence, to collaborate with the social services and other authorities of organization, document symptoms and signs of violences, ensure staff competence with this era, the care of child that are affected by violence. Then we give family-centered care, family-related care, and family-focused care. Documentation of principle, verbal findings, physical findings, care given chain of custody. Documentation needs to be complete and accurate. Surgery or procedure may alter evidence. Documentation should be included objective and subjective symptom of trauma. Documentation principle. Obligation to report must be report suspected abuse or neglect of a child or elderly person. Report must be made within 48 hours. Date and time of injury and time and arrival. Mechanism of injury. The first step to proper evidence collection is to documentation. We must take the informed consent before going to interview or any procedures. Communication between the nurses and the victim that explains the risk and benefits of undergoing the examination or procedure. Options for not participating in procedures, can proceed without consent, otherwise ordered by the investigating officer, we can examine. Conceal. The main point is conceal. Don't reveal any clue or any identity about the cases. Don't reveal the story of the victim. Should keep the privacy of evidence that has been collected from the victim in order to produce before the court of law. Confidentiality of the victim. The second important thing is to give file name, pseudonym, belongs and clause should be handed over the police and receive sign from them in front of the family members. Otherwise, the family members can blame. Unknown victim belonging and cloth should handed over to the duty of police officer through inquest officer. If female patient, we need to ask the LMP status. Privileged communication for patient and the staff. Victim rights is to disclose the information or not. Don't force to do. We can't force them to get an answer from them. Victim can ask anything. Right to refuse physical examination or done. Victim should be treated with compassion and respect for their dignity. Social work. Provide referrals and resources for aftercare, social work and therapy as well as after discharge also. Chain of custody. Chain of custody is the responsibility of the medical professional collecting the forensic evidence until a duly authorized agent takes responsibility and sign the collection kit with the time and transfer. Chain of custody, unbroken history of a piece of evidence from the time it is collected until the time it is used in court. Documentation of all processing the evidence is crucial to the integrity of the chain of custody process. That means document, date, time, and name of the person handling evidence. Child abuse is also including in this part. The importance of a nurse here is key to determine the difference between the inflicted bruise or usual activities. Forensic nurse will know the bruise and located the ears, neck, and the other soft tissues of the body should be raised red flag. Sir has already said that. I'm not going too deep. The forensic nurses make sure to build this relationship to follow the child to share details they otherwise might keep to themselves. If abuse is detected, the nurse will take the next step to reporting the abuse. Children need specialized medical care, and the pediatric nurse's role is an important part of the healthcare team for children. Pediatric nurses are registered nurses who have received additional training working with the children in the medical setting. Pediatric nurses who work with children ranging from newborns to teenagers and typically receive the extensive on-the-job training. The emotional support of the child. Prepare the pediatric registered nurse duties vary depending on the clinical setting. They also clean and sew up wounds, even reset bones and put on cast. In case they have any fracture, as well taking care of kids' injuries and illness, pediatric nurses help educate parents and caregivers regarding their children's health. Pediatric nurses also design home care plans to assist families in pediatric to take care of the special need of the patient suffering juvenile diabetics, paralysis, or other chronics. In case the child is below 12, we need to ask the parents' concern. In case 12 to 18, we have the right to take the consent from the child. Above 18, we need to take the self-consent. Or for unknown patients, we can take the consent from the inquest officer or the family members. Forensic assessment nature of the current assault history of the abuse, the risk assessment, mental emotional health, forensic physical exam, collect forensic evidence. Risk management. RN jobs without no patient contact can be found in the growing field of risk management. Risk managers help identify the primary causes of mistakes, work on system, process improvements, and deal with the medical malpractice. The nurses risk manager may work in a hospital, ambulatory care facility, or other healthcare organization as well as for an insurance company or law firm. Mental health affected after an assault. The psychiatric nurse or the sexual assault can affect someone's mental. Nurse can see any sexual assault can affect someone's mental health either short term or long term. This can lead to depression, anxiety, and even the suicidal feelings. Patients who have history of mental illness may be even more adversely affected. If someone who has been sexually assaulted already has a therapist, it is good idea for them to make an appointment with them. We can ask them. It is good idea to stay connected with an advocacy agency after sexual assault, as feelings may continue to come up months or even years later as a person heals. We need to provide emotional support for the sexual assault patient. The empathetic nurses can help provide emotional support by the listening and allowing patient to express whatever they feel. Children may respond to the gift of a stuffed toy to which they can confide all the bad things that have happened to them. The older adult may be ashamed or to admit that her children are abusing her. Nurses often an opportunity to talk about feelings and may also be able to suggest a referral to counselor who is experienced in the dealing with the abusive victim. In case of any masters in social work, counselors can also counsel the sexual assaulted patient. The nurses may also be the first person to recognize a symptom of depression or suicidal intent in an abused victim. Physical action. In the ideal situation, forensic nurses will be the first healthcare professional to deal with the victim of violence of abuse. It includes sexual assault, domestic violence, etc. He or she may also be called on or assess or collect evidence from the perpetrators on the victim of the crime. The type of evidence collected include specialized digital photographs. Physically is also same. Abuse the victim of endured physical nursing care. In the emergency room, may include cleaning wounds, applying dressings. Psychological aspects. The nurses care critical in providing comfort and emotional support and education to the victims and their families. We can provide music therapy, counseling, medical support, and stand with the patient. Cultural aspects. Forensic nursing care involves an awareness of culture and societal influence on violence, abuse, and trauma. It also requires a commitment to social justice and access to the care. Legal aspects. Sir is already tell. Forensic nurses are registered nurses who received specialized education and training to provide care to the patients who experience victims of violence. They are the first point of contact between the victim, crime, and the health and the care system. Spiritual well-being. We need to entertain all the measures to enhance spiritual well-being alike. We can provide prayer room, provide religious book. Then we can ask what all things they wanted to. Compassion. Victims should be treated with compassion and respect for their dignity. The forensic evidence collection process. The evidence collection is already covered. Then also I'm giving some points. Use disposable tool and clean them between each sample. If possible, have the patient remove cloth and comb hair over a clean white sheet. Carefully fold the sheet when we are collecting the materials. Carefully fold the sheet and place in a paper bag and label. Do not sneeze, cough, or talk in a manner that might contaminate the evidence. Do not use stable or leak envelope to seal. Evidence collection principles. Label all bags with the patient name and hospital numbers. That is case number. Date, time, and initial. Fold top of bag 2 times. Seal with the tape all the way across time, date, and initial seal. The kit, you all know, required kit contain crush-proof box, white envelopes, 3 frosted ended glass slides, 2 small narrow tooth combs, we need 2 combs because purple top blood tubes and 110 cc blood tubes, nail file for pick, 4 subs for each. We need total 20 subs. Vaginal and oral and anal, 2 body surface of the area, 2 plain envelopes for the other evidence that needs. Collection of clothing, it's very important. Clothing may contain blood, semen, sweat, saliva, skin hairs, and fibers as well as debris from the crime scenes. Drainage of ejaculate from the vaginal or anal cavities may collect on panties or underwear we need to collect. Damaged or torn or clothing may be significant. Any item of clothing worn during the assault or prior to the exam may need to be collected. Collection of body fluids. Fingernail scrapings. We asked the patient if they could have left mark or scratch on the offender's face, body or clothing. May use orange stick and plastic stick. You may use small cotton soap lightly moistened with sterile water. Scrubbings should be separated for each hand and obtained over separate pieces of paper. Label as right hand and left hand. All blood and saliva specimens. Combing. Combing is also serious. Head care comb over a piece of paper. Collect all those hair and fibers. Combing and comb hair folded into the paper, placed in an envelope. Combing. Pubic hair and second comb. We need to use 2 hair because of 1 head hair, and we need to label like first comb and pubic hair is second comb. Combed collection sites of section or between the upper and the lower lip, gum and along with the ingia or vagina and cervical cuff. Check or contraceptive is receptive or sanitary devices and certain for the evidence. Bleeding sites. Forensic evidence collection and preservation. Complete information on the top of the kit. Immediate seal with the red orange evidence tape. Conclusion. Forensics are given a key role in the care of the victim of violence, and they apply nursing process to public or legal proceedings. Preparation of forensics, the care in the scientific investigation of trauma, death related to abuse. This specialty has started to be organized worldwide and is helping to promote international focus on violence. As a forensic nurses, we can't change their life, but we can help them. Thank you.
Thank you, ma'am, for explaining forensic nursing, roles and responsibilities on comprehensive care of victims and family. As the token of appreciation, we would like to award this certificate to you, madam. Your session was very much informative and rewarding. Thank you, madam.
Thank you.
Before entering into the next session, few instructions to the delegates. Kindly fill up the feedback form given in the chat box after the third session. E-certificates will be provided to the participants after submitting the feedback form. Now, we are moving on to our third session of today's webinar. We have an eminent person who is highly oriented and knowledgeable on Indian judicial system and fundamental rights. Let me introduce Mr. P.A. Varghese, retired Deputy Superintendent of Police. He holds post-graduation in criminology and forensic science. He has a master's at law and he is assistant professor in Bharat Mata School of Legal Studies at Alva, Ernakulam. He was in the service for 33 years and retired as DYSP. He has worked in various units such as Crime Branch, Vigilance, State Intelligence Wing, and Anti-Corruption Bureau. He was a chief instructor in Police Training College, Trivandrum, and Kerala Police Academy, Thrissur. He is well known for his crime investigation skills and detective excellence, and also widely acknowledged for the diligence, perseverance, and strictness in his duties. He was awarded with State Police Chief Excellence Award, Badge of Honor for Detective and Investigation Excellence, Chief Minister Police Medal for Meritorious Services, and Indian President's Police Medal. It's my pleasure to invite Mr. P. Varghese, retired DYSP, to take over the session. Over to you, sir.
Hello, first of all, I congratulate the Ashwini College of Nursing for conducting this national webinar, and especially the organizing chairperson, Dr. Lieutenant Colonel Rosie Kevo, Principal, and Professor Kavita B, Vice Principal, and other official teams and members of Ashwini College. Hope that my presentation is visible and I am audible, all of you. Isn't it?
Yes, sir. Yes.
Already Dr. Uday Kumar and Mrs. Sheba Joseph already presented their valuable information regarding the forensic nursing and the role played by medical professionals in the criminal judicial administrative system and the importance of medical professionals regarding the forensic nursing. I am only trying to provide some basic information regarding the present Indian judicial system and fundamental rights that have been ensured in our constitution. So with regard to the criminal judicial administrative system and judicial system, presently we have the objective of criminal judicial system and the judicial system is to, first of all, to prevent the occurrence of crime. We have to prevent the occurrence of crime, and if any occurrence of crime, if any crime is committed, the accused or criminals have to be punished. For that, a well-settled criminal justice system and judicial system and legal system is essential. So, if the criminals are convicted, they have to be rehabilitated. So, there should be a prison system, and the victims of crime has to be compensated properly. And for the maintenance of peace and order or law and order, there should be a legal system, judicial system, and criminal judicial administrative system. With regard to the historical background of Indian judicial system, we have a long history from the Vedic, Bronze and Indus Valley civilization. We have a settled legal system and a judicial system. During the Hindu period, Hindu kings ruled in India. During their period, the well-known source of law was the Hindu law, classical Hindu law or Dharma Shastra. Hindu Dharma Shastra deals with the legal and religious duties of king and citizens. The main source of Hindu law was the Dharma Shastra. Dharma are Vedas, Smriti and Ajara. Our Vedas, Smritis and customs or Ajara was the main source of Hindu law during that period. Ajara or customs was used in matters where Vedas and Smritis were silent. Dharma Shastra is a Smriti. Dharma Shastra is a prominent legal text written in Sanskrit. It has been translated to many languages in the world. This Dharma Shastra containing information such as the principle of law, duties of king, and the manner of evidence and witnesses during the trial of a case. So from the period of Dharma Shastra, we have a well-settled trial system in criminal cases. During that period, the king was in command of the court system and it was counseled by the ministers of the king. During that period, the legal procedure followed was Vyavahara under Hindu law. Presently, we have Criminal Procedure Code and Civil Procedure Code as the procedure to follow during the trial of a case. But during that Hindu period, Hindu king's period, Vyavahara was the procedure law. After the Hindu king period, the Muslim and the Mughal kings invaded into India. They conquered many parts of India and they ruled many centuries in India. Babur, who was the first emperor of Mughal Empire, who founded the Mughal rule, that was in 1526. His son Humayun, who succeeded him, this Humayun has set up a separate justice department for criminal judicial administrative system. That system was known as Mahakuma Adalat. That was for the proper administration of justice. During the period of Mughal Empire, the source of Muslim law mainly was Quran, Sunnah and Hadith, and Ijma and Qiyas. Sunnah means the method, Hadith was traditions or customs. That was also similar to that of Hindu period. After the Mughal Emperor period, the British rulers came to India and ruled many parts of India for centuries. They came to India into 16th century for trade and later they came into power in India. During 1726, the judicial system was introduced by the British. Court system known as the Mayor's Court was established during 1726 by the English East India Company. They have set up this court at Madras, Bombay and Calcutta, main presidency cities of India during that time. Subsequently, The British rulers made many experiments in the legal system, judicial system, and administrative system of India up to the period of independence of India. The present judicial system in India was on the basis of Constitution of India. Presently, the judiciary derives its powers from the Constitution of India. The Indian judiciary is the guardian of the Constitution of India. We have a largest written constitution in the world. Our constitution is the custodian of the fundamental rights of the citizen. Our judicial system is also the custodian of the fundamental rights. Presently, the judicial system in India is in the form of a pyramid. The Supreme Court at the top. At the bottom is a judicial first class magistrate. In between, there were other courts. The Indian Constitution established the Supreme Court as the apex and independent judiciary in order to ensure the supremacy of Indian Constitution. There were various punishment that can be awarded under Indian judicial system. They are first one, simple imprisonment, simple fine or imposing fine is the first punishment. Next is awarding of simple imprisonment. Another is rigorous imprisonment. In heinous crime or grievous crime, life imprisonment will be awarded. Another type of punishment is imprisonment unto death. In the imprisonment unto death, the convict has to undergo punishment till his or her death in the prison. The most important punishment that can be awarded by the legal system in India is the death penalty or a capital punishment. Death penalty can only be awarded in rarest of rare cases. With regard to the hierarchy of our court system or judicial system, we have a pyramid structure of a court system. At the top, Supreme Court. Supreme Court can award a punishment as authorized by the law of India. That is the topmost punishment that can be awarded is death penalty. Below the Supreme Court, there were high courts. High court can also award punishment, all the punishment including death penalty to the convict. Below the High Court, Sessions Court were established for conducting trial of criminal cases. Civil cases can also be conducted by the Sessions Court. Sessions Court can also award punishment including death penalty. But death penalty can only be awarded after confirmation by the High Court or Supreme Court. The convict have the liberty to file appeal, revision, etc. in the upper court, and the upper court has to confirm the death penalty awarded by the Sessions Court. Below the Sessions Court, there are Assistant Sessions Court. Assistant Sessions Court can award punishment up to 10-year imprisonment. Below the Sessions Court, there are Chief Metropolitan Magistrate Court. This Chief Metropolitan Magistrate Court can award punishment up to 7-year-old. Below that, Chief Judicial Magistrate Court also there. this magistrate court can also award a punishment up to 7 years. So the court system fixed a certain limitation for awarding punishment. According to the gravity of these cases, trials are being conducted in various courts. Below the Chief Metropolitan Magistrate Court, there are subordinate courts such as Metropolitan Magistrate and Special Metropolitan Magistrate. Both these Metropolitan Magistrate Court can award punishment up to 3 years. Below the Chief Judicial Magistrate Court, there were Judicial First Class Magistrate Court. That is the lowest court. This court can award punishment up to 3 year imprisonment and a fine of rupees 5,000. Various provisions have been included in the Criminal Procedure Code with regard to the collection of evidence, conducting investigation, and conducting trial, establishing the guilt of the accused. In addition to this, court system as stated above, separate court system have been established for conducting trial in POCSO Act cases. POCSO Act, that is the protection of children from sexual offences. This act was enacted during 2012 in order to provide protection to the children, that is both male and female, from the offences of sexual assault and sexual harassment and child pornography. There were numerous sexual assault, sexual harassment, and child pornography are going on. Under such offences and protect the children from the sexual harassment, sexual assault, the special act was enacted during 2012. And in order to conduct a trial of these child harassment cases, special courts are being set up, that is for POCSO Act cases. These POCSO Act cases can award punishment up to death penalty. These courts are conducting trial in sessions court. So these special courts are being set up in every parts of India. Numerous courts are being set up nowadays in order to conduct the trial in a speedy way. In our Supreme Court, the relevant provisions in the Constitution contained in Chapter 4 of Part 5 of the Constitution. That provision contained in Article 124 to 147 of Indian Constitution. Various constitutional powers, establishment of court system, etc. contained in these articles. Our Supreme Court covers 3 categories of jurisdiction. That is, first one is original jurisdiction. That is as per Article 131 of Constitution. Original petitions can be filed and trial can be conducted in Supreme Court. The second jurisdiction regarding the appellate. In lower court judgment, appeals can be filed in Supreme Court. That is the appellate jurisdiction. That is as per Article 133 and Article 134 of Indian Constitution. The Supreme Court was also advisory jurisdiction for advising the state government and central government in certain legal matters, etc. That is as per the powers conferred under Article 143 of Indian Constitution. The Supreme Court judgment shall be binding on all lower courts in India. As per Article 141 of Indian Constitution, the law declared by the Supreme Court or the judgment of the Supreme Court shall be binding on all the lower courts within the territory of India. Below the Supreme Court, there were high courts in almost all states. Presently, in India, there are 25 high courts. 6 high courts have control over multiple states as well as union territories. The oldest high court that was established in 1862 in Calcutta, that was during the British rule. The Constitution and its powers of high courts are dealt with in various articles of Indian Constitution from 214 to 231. Various provisions with regard to the Constitution of high courts and their powers, appointment of judicial officers, etc. were dealt with these articles of Indian Constitution. As regarding the jurisdiction, similar to Supreme Court, this High Court was appellate jurisdiction, original jurisdiction, and supervisory jurisdiction of the lower courts. Regarding the writ of jurisdiction, as per Article 226 of Indian Constitution, citizens can file writ petition before the High Court in order to establish their fundamental rights. അത് അവിടെ നിന്ന് എങ്ങനെ എങ്ങനെ അല്ല അതിന് മുമ്പ് അത് അവിടെ നിന്ന് ചേഞ്ച് ചെയ്യുന്നത് കിട്ടുന്നില്ല. ഞാൻ ചേഞ്ച് ചെയ്യുമ്പോൾ കിട്ടുന്നില്ല. ഉണ്ടോ? ഓക്കെ. Okay. With regard to the writ of jurisdiction, High Court can conduct a trial with regard to the breach of fundamental rights. That was as per the Article 226. Below the High Court, there were district court in every district of India. Presently, there are 672 district courts all over India. With regard to the constitution and establishment of various district courts, Chapter 6 of Part 6 of the Indian Constitution deals with the subordinate court and district court. This district court regulate matters of justice in particular area of district, chaired by a district judge. Mainly, the criminal cases are being dealt by the district court and subordinate courts. High courts and Supreme Courts are not conducting criminal trial. They are hearing only the appeal or revision. So in the criminal judicial administrative system, mainly the district court and assistant district court and first class magistrate court and other metropolitan magistrate courts are conducting trial of criminal cases. In addition to this criminal court, for alternative dispute resolution, some other judicial system is also being set up in India, that is Lok Adalat. These are subordinate courts which provide a system for alternate dispute resolution. Here in Lok Adalat, they are not dealing with the criminal trials. They are conducting other civil dispute, etc. for speedy dispute redressal system. In addition to these Lok Adalat, at the village level, another court system was established recently on the basis of a Grama Nyayalayas Act that was enacted in 2008. The central government was enacted the Grama Nyayalayas Act during 2008. It provides for establishment of Grama Nyayalaya at intermediate panchayat level. Only in village panchayat level, this court system is functioning. Presently, 256 such courts are established in 10 states. These are only in a basic structure of conducting minor cases in village level. For redressal of certain other dispute regarding tax cases, land cases, Consumer Act cases, etc., tribunals are also being set up in India in accordance with the provisions in Indian Constitution and other legal system. These tribunals are for speedy disposal of some dispute with regard to the tax cases, land cases, and consumer cases, etc. In addition to the criminal court system, civil courts are also being set up in India for the redressal of civil dispute. Civil courts provide remedies for civil wrong, not criminal wrong. Civil wrong committed by individuals can be settled in civil court. Civil matters range from property dispute to breach of contract to divorce case or marriage related cases, etc., family dispute, etc., can be dealt in civil court. Civil court follow the principle that ubi jus ibi remedium, that is a Latin maxim. It means that for every wrong, the law provides a remedy. Unless expressly or impliedly barred by any other law in force, civil courts have the jurisdiction to try all suits of civil nature. With regard to the civil court hierarchy in district, there were district court, below the district court, sub-judge court, and below the sub-judge court, there were municipal court. These three courts are dealing with the civil dispute according to the gravity of cases. The district court, that is sessions court, the district judge combines the powers of trying both civil cases as well as criminal cases. Below the district court, for dealing with the civil matters, sub-judge court were set up in our country. The sub-judge court can deal with the cases civil dispute, monetary dispute more than 1 lakh rupees. If the monetary dispute is below 1 lakh rupees, these cases are being trialed the Munsi quota, that is under the sub-judge quota. So with regard to the dispute of civil matters, Munsi quota, sub-judge quota and district courts are dealing with the civil matters according to the gravity of cases. With regard to the binding value of judicial precedents, the decisions of Supreme Court is binding on all subordinate courts in India. So all the states in India have to follow the judgment or law declared by Supreme Court. With regard to the High Court judgment, their judgments are binding only to the lower courts in the concerned state only. In other state, the decision or judgment of a High Court is not binding. With regard to the lower courts, the order or judgment of the Sessions Court under their jurisdiction are binding to the lower courts. There were some issues with the Indian judicial system. The main system, that is the drawback, is the delay of conducting trial. Large number of lawsuits are pending in courts at all levels of the judiciary. So the pendency, huge pendency of cases are the main drawbacks of Indian judicial system. According to the data from the Department of Justice, National Judicial Data Grid database, courts recorded a 27% increase in the pendency between 2019 to 2022. So the main issues with the Indian judicial system is the huge pendency of under trial cases. There is a legal maxim that justice delayed is justice denied. If the justice or conducting of trial is delayed, the aggrieved party who experienced the injury always hopes for fast and efficient redressal of the dispute. So the delay in conducting trial badly affect the aggrieved party and the victims. In order to rectify these drawbacks, the Indian government is attempting to remove the impediments and backlog in this respect. With regard to the fundamental rights under the Indian Constitution, our Constitution is the supreme law of the land. Our Constitution lays down the framework defining principles, powers, and duties of government institutions. And our Constitution set out fundamental rights and directive principles and duties of citizens. With regard to the salient features of Indian Constitution, it is the longest written constitution in the world. Currently, our constitution has 448 articles in 25 parts, 12 schedules, and 5 appendices. Our constitution came into effect on January 26, 1950. After the enactment of the Constitution, already we have made 104 amendments in the Constitution. Our constitution preamble include the salient features of our constitution. Our constitution is mainly intended to constitute India into a sovereign, socialist, secular, democratic republic. Our country is a sovereign, socialist, secular, democratic republic. Our constitution secure all its citizens justice, that is social justice, economic justice, and political justice. Our constitution secure liberty of thought, liberty of expression, liberty of belief, faith, and worship to all citizens. Our constitution secure equality of status and opportunity. And our constitution has to promote among all the citizens all fraternity, assuming dignity of the individual and the unity and integrity of the nation. So our preamble consists of the main objective of our constitution. Dr. B.R. Ambedkar is widely regarded as the father of Indian Constitution. With regard to the fundamental rights in the Indian Constitution, our Indian Constitution Part 3 from Article 12 to 35 contain various provisions with regard to the fundamental rights. These fundamental rights guarantees civil liberties such that all Indians can lead their lives in peace and harmony. There are 6 important fundamental rights that have been included in our constitution. The first fundamental right is right to equality. Second one is right to freedom. Third one is right against exploitation. Fourth one is right to freedom of religion. Next is cultural and educational rights. Last one is right to constitutional remedies. Initially, there were 7 fundamental rights in our constitution. But during 1978, by 44th Amendment of our constitution, one fundamental rights with regard to the right to property under Article 19, subclause 1, subclause F, and Article 13(1) was deleted. And presently, this right to property is not included in the fundamental rights. But another article was amended and included in the Constitution by Article 300A. By this 300A, presently the right to property was changed from the fundamental right to a legal right only. With regard to the right to equality, that was included in Article 14 to 18 of our Constitution. Right to equality refers to the equality in the eyes of law. Before the eyes of law, every citizen is equal. Discarding any unfairness on grounds of caste, creed, race, religion, place of birth, and sex. All are equal under the Constitution. All human beings are born in dignity and rights. So all are equal before the law as per Indian Constitution. Second right with regard to the freedom, right to freedom. as per provisions in Article 19 to 22. 5 freedoms have been described as right to freedom. First one is freedom of speech and expression. Everyone has the freedom to speech and expression in our country. Second one is freedom to form association or union. Third one is freedom to move freely towards the territory of India. Next, freedom is freedom to reside and settle in any territory of India. Next is freedom to practice any profession as per their lives. So these right to freedom have been included in Article 19 to Article 22 of our Constitution. Next, fundamental right with regard to the right against exploitation that have been included under Article 23 to 24. This right against exploitation aim at protecting citizens from environmental, domestic, and work hazard. These consist of two major provisions. First one is abolition of forced labor. Presently, no forced labor is in our country. Next one is abolition of employing of the children under 14 years of age. Child labor is prohibited as per our Constitution. Next, fundamental right with regard to the right to freedom of religion that have been included in Article 25 to Article 28 of Indian Constitution. This right supports the freedom of an individual or group, that every citizen has the right to practice and promote their religion peacefully. The concept is generally recognized also to include the freedom to change religion voluntarily or not to follow any religion. So according to their lives, they can change religion voluntarily or not to follow any religion. That is the right to freedom of religion under Article 25 to 28 of Indian Constitution. With regard to the fifth fundamental rights, with regard to the cultural and educational right, these rights have been included in Article 29 to 30. This right allows every citizen of India to have a cultural and education up to where that person wants. No citizen shall be denied admission into any educational institution on the basis of religion, race, caste, language, or any of them. So all are free for conducting education. No discrimination on the basis of religion, race, caste, language, etc. The last fundamental right with regard to the constitutional remedies. So if any of the fundamental rights are denied, citizens can approach the Supreme Court and High Court in order to establish their fundamental rights. So as per Article 32, citizens can approach Supreme Court for the violation of their fundamental rights. As per Article 226, citizen can approach High Court in order to establish their fundamental rights. So Supreme Court and High Courts are the guardian of our constitutional rights and fundamental rights. Our Constitution came into force on 1950. During 1948, United Nation organization, that is UNO, has declared the universal human rights. The Universal Declaration of Human Rights by the United Nations organization articulate human rights and freedom for all. The General Assembly of UNO adopted this declaration. Our constitution followed these human rights and included some of the human rights as fundamental rights. Fundamental rights and human rights are not one and the same. If the fundamental rights are violated, citizen can approach the Supreme Court and High Court for getting their fundamental rights. Human rights are the rights of inherent to all human beings by birth. These human rights inherent to all human beings regardless of gender, nationality, place of residency, sex, ethnicity, religion, color, or other categorization. All human beings have the human rights by birth. Fundamental rights can be enforced. If any violations occurred, that can be enforced through the court of law. These rights are justiciable or enforceable through court. By filing writ petitions before the Supreme Court and the High Courts, we can regain our lost fundamental rights. Fundamental rights is to secure the political freedom of people. The main objective is to secure the political freedom of people. So it has been ensured in our constitution. All the political freedoms of people are secured through the fundamental rights by our constitution. Fundamental rights are not of absolute nature. Some of the fundamental rights can be curtailed or reasonable restrictions can be imposed on the fundamental rights. That is especially during the declaration of national emergency, our fundamental rights could be suspended. On declaration of national emergency, right to freedom under Article 19 is immediately be suspended. So the freedom under Article 19 will be curtailed immediate after the declaration of national emergency. Even on the declaration of national emergency, two fundamental rights, that is a right to life and personal liberty under Article 20 and 21, cannot be suspended. Even on national emergency, these fundamental rights under Article 20 and 21, that is right to life and personal liberty, will still exist. So we have a lengthiest written constitution with the fundamental rights. So proud to be an Indian that we have the lengthiest constitution in the world. Our constitution drawn from various sources. It synthesizes of parliamentary sovereignty and judicial supremacy and the rule of law. So our constitution ensures parliamentary sovereignty and judicial supremacy and the rule of law. So we have a well settled criminal judicial administrative system and rule of law. And the supremacy of the constitution, supremacy of the judicial system existed in our country. It is the time to leave our differences behind and come together and fight for things that are fundamentally right. Every citizens have to leave our differences and come together and fight for things that are fundamentally right. Fundamental rights are of no use until we use our fundamental rights for the betterment of our nation. So we have to use our fundamental rights for the betterment of our nation. Let us show our strength in number and solidarity. It is to be considered that law is certain. Remember that justice is blind. Legal language is very precise. Fundamental rights intended for the well-being of the citizen. We have a well-settled criminal judicial administrative system and judicial system and constitution that ensure the fundamental rights of every citizen. So in the criminal judicial administrative system, if any crime is committed, there is a system of proper investigation, proper conducting of trial. So for the criminal judicial administrative system, the medical professionals are playing an important role. Your profession is a noble profession. And for the administration of justice, for collection of evidence, there are important role to be played by the medical professionals. So the forensic medicine and forensic nursing are important for the criminal judicial administrative system. In order to establish the guilt of the accused, there should be valid evidences. That evidence to be collected without losing the important evidences. Guilt of the person accused has to be established beyond reasonable doubt. Then only the accused can be convicted. Otherwise, they will be acquitted. So, for the collection of evidence, medical evidence, the role played by the medical professionals are very much important. Already, Dr. Uday Kumar and Mrs. Shiva Joseph Hassa described various important points with regard to the forensic nursing. So, with regard to the criminal investigation, the investigating officers has to collect various evidences, including medical evidence and forensic evidence, in order to establish the guilt of the accused beyond reasonable doubt. So, with regard to the criminal judicial administrative system, the role played by the medical professionals are very much important. So, considering this, your profession, you have to contribute much for the criminal judicial administrative system. So I am concluding this presentation, wishing you all success and prosperity in your noble medical profession. If any question, please ask.
Thank you, sir, for enhancing our knowledge on Indian judicial system and fundamental rights. As a token of appreciation, we would like to award this certificate to you. I'm sure that all the delegates received a clear knowledge and idea about forensic nursing and our theme in particular. Our distinguished resource persons elevated us in the science by their knowledge and experience in their respective fields. Thank you. All participants are requested to fill up the post-test form and the feedback form. The link has been posted in the chat box. E-certificates will be provided to the participants after submitting the feedback form. Dear delegates, now the forum is open for discussion. If you have any queries, feel free to proceed by unmuting your mic. If no more questions, we can wind up this session. Thank you all for the participation. I request all the delegates to kindly turn on your camera as we can take a screenshot to make this memory a timeless treasure. Kindly, please turn on your cameras. This may take a moment. Please cooperate. It's time for vote of thanks. I invite my classmate, Miss V.S. Christina, final year BSc Nursing student. Christina, please.
Thank you, Sheena, for inviting me. Good afternoon, one and all. On behalf of the organizing team, indeed, it's a great honor and privilege to propose a vote of thanks. No duty is more wiser than that of returning gratefulness. On this memorable occasion, I bow my heart with bouquet of gratitude for making today's occasion a resounding success. I take this golden opportunity to express my heartfelt thanks to our beloved principal, Lieutenant Colonel Dr. Rosie Keyo, for the tremendous support, resourceful guidance, and encouragement for this webinar. Thank you, ma'am. Next, I extend my exceptional gratitude to our Vice Principal, Professor Kavita B, for her detailed guidance, valuable contribution, and constructive suggestions for this webinar. Thank you, ma'am. Besides the over-embellished schedule, spare time for sharing pearls of wisdom with us. I extend my sincere gratitude to Dr. Uday Kumar, Professor of Forensic Medicine and Medical Superintendent of Father Muller Medical College, Mangalore, for an extraordinary presentation on forensic science, overview of concept and importance. It was exceedingly enlightening to us. Thank you, sir. I extend my sincere thanks to Mrs. Sheba Joseph, Senior Nursing Officer, JPNATC AIMS Delhi, for an interesting and poiseful presentation on forensic nursing, roles and responsibilities on comprehensive care of victim and the family. Thank you, ma'am. Next, I would like to thank Mr. Varghese P.A., retired DYSP, for his considerate approach and presentation on basic orientation, Indian judicial system, and fundamental rights. Thank you, sir. I would like to thank Professor Rashmi C.R., HOD of Community Health Nursing, for her inspiring felicitation. Thank you, ma'am. Next, I would like to thank all the HOD of various departments and all faculty members for their constructive suggestions and constant support to make this occasion a grand success. Thank you all. I would like to express and extend my heartfelt gratitude to all delegates who made this occasion a great success by their presence. Thank you all. It takes great planning and unity for feasible things to happen. In this regard, I thank all my classmates for their wholehearted cooperation and assistance. Once again, a warm thanks from the bottom of my heart. Thank you all.
Thank you, Christina. All the delegates will be receiving their certificates through email. Here, we are winding up the session. Once again, thank you all for the participation for the success of the webinar. Thank you.